Hello, my name is Shannon Law. This is my presentation regarding yoga as an adjunct therapy for military veterans to reduce suicide and the stakeholder education required for implementation. Suicide rates within our military veterans has become an increasing concern due to the amplified incident of death by suicide and the significant changes identified as war progresses over the years. The underlying causes of suicide are unknown, and the acts are completed for many different reasons. However, suicide within veterans has been linked closely to mental health illnesses. According to the U.S. Department of Army, between 2005 and 2009, suicide rates almost doubled. In 2016, annual suicide rate among veterans aged 18 to 34 was 45 deaths per 100,000 veterans, the highest of any age group. This is up from 40.4 in 2015. The suicide rate for veterans was 1.5 times greater than for Americans who never served in the military, and equates to about 22 veterans a day taking their own lives. In 2016, within the United States, 14% of all adult suicides were veteran. However, only 8% of the entire country's population has ever served in the military. Over the course of 2005 to 2016, the national suicide rate nearly rose 21%. Among veterans alone, the rate increased 26% within the same time frame. Perhaps the greatest healthcare cost of suicide is the drastic cuts being applied to mental health services and support. From 2009 to 2011, cuts to mental health non-Medicaid states funding totaled nearly $1.6 billion, and services were stopped, including community and hospital-based psychiatric care, housing, and access to medications. A stimulus package allowed for the temporary increase in federal funding for Medicaid. However, this funding has ceased, leaving those individuals without help. Consequences to these cuts has led to increased emergency room visits, hospitalization, premature death, and suicides, as well as further diminished access. Within rural residential areas, there are only 16 psychologists per 100,000 rural residents, and about half that amount in urban and suburban areas. Within this rural population, approximately 85% live in an area where there is a shortage of mental health professionals, and the providers that do practice feel less knowledgeable regarding PTSD, substance abuse, depression, and suicide treatment, and do not typically ask their patients if they are veteran. Individuals with mental health illnesses are also cared for by family, friends, and relatives. On average, 32 hours a week are spent on caring for these family members. However, there is no monetary gain from it. The U.S. economy loses $193.2 billion a year in lost earnings. In addition, in 2014, 1 out of every 8 Americans aged 12 and over were currently prescribed and taking antidepressants. Between 1999 and 2014, the cost of antidepressants rose 65%, leading to a greater burden on consumers to purchase their medications required for treatment. So what are we going to do about it? Utilizing cognitive behavioral therapy with yoga as an adjunct therapy compared to treatment with medications may help the population of individuals reluctant to take medications and receive treatment for their mental health and professional psyche. A comparative study completed by Theoratali and colleagues looked at the effects yoga would have on the elevation in brain-derived neurotropic factor and scores on the Hamilton Depression Rating Scale. The study found that participants in the yoga therapy group reduced their HDRS scores and serum BDNF rose more than those that were solely taking medications for their depression. According to Howlett, during yoga, endorphins are released, allowing for one to experience reduced anxiety, stress, and depression. Research has also proved prescription antidepressants are only effective in about 1/3 of all cases, and side effects of prescription drugs can be severe, and relapse rate is higher when medication is used as a sole treatment for meth. How do we do this? With you, our stakeholders. Stakeholders related to the implementation include our military veterans, as they are the key to implementation and treatment. Our military families, who will be the ones encouraging them to continue their treatment and will be affected by the outcome. The U.S. military will be able to place soldiers in care and reap the benefits from the outcome. Hospital staff will need to have buy-in into the use of yoga, as well as be there during treatment in order to assess for change. Lastly, we would need investors in order to keep the project going. As veterans, their role is not significant until the treatment starts. At this time, they will be the ones attending sessions and keeping the program going. Military families will be there for encouragement. As the project is implemented, it will help that families push their loved ones and encourage them to attend. The U.S. military will aid in implementing by approving the yoga therapy as well as getting soldiers enrolled in classes. Hospital staff will set up and attend to the soldiers taking the class. They will make sure everything needed is there, such as equipment, and help in implementation of the project. Our investors will be there to supply the money for their implementation to occur. They will attend a mock production of the project so they can see how it will work and provide additional thoughts for change and implementation where they see a change is beneficial. Developed by American psychiatrist Aaron T. Beck, cognitive behavioral theory is a therapeutic approach used to identify and change mental thinking and feelings. Beck's theory incorporates 2 separate theories looking at the cognitive being of the person and their behavior, producing a theoretical complex combination of therapeutic approaches. Derived from cognitive theory and behavioral theory, each has commonalities in assumption, techniques, and research strategies, but differ in the understanding of how cognition affects behavioral change. Cognitive behavioral theory reflects to the importance of both cognition and behavioral change, required to make a difference and affect the internal being. Beck believes that utilizing our cognition, our negative thoughts generated by dysfunctional beliefs, are typically the primary cause of depressive symptoms, and individuals tend to affirm this belief by focusing on certain events and thoughts. Beck's theory states, patients view themselves as defective, inadequate, diseased, or deprived, and as a result, look at themselves as worthless, undesirable, their future is hopeless, and believe there is nothing that can help them internally or externally to solve their problems. Beck developed cognitive distortions to represent concepts within the cognitive behavioral theory, as they are as follows. Arbitrary interpretations, thoughts that occur without evidence to support the conclusion. Selective abstractions, focusing on detail taken out of context and ignoring other concrete evidence. Overgeneralization, see a single negative event as a continuous pattern of helplessness. Magnification and minimization, exaggerate or minimize importance of events or feelings. Inexact labeling, the effective reaction is proportional to the descriptive labeling of the event rather than the actual intensity of the traumatic situation. Personalization, see yourself as the cause of something negative, even if it was not your responsibility. Absolutistic, dichotomous thinking, tendency to place all experience in one of two categories, flawless or defective, immaculate or filthy, saint or sinner. Additions to these concepts later added are as follows. All or nothing thinking, sees things as black or white. If you are not perfect, you are a total failure. Mental filter, picking a single negative detail and fixating on it. Disqualifying the positive, reject all positive. Jumping to conclusion, make a negative prediction for no reason. Emotional reasoning, feelings of being unworthy and believe it is to be true. Each of these concepts is something that can be developed, changed, or restructured within the mind and behavior of a veteran going through PTSD and depression to prevent the possible outcome of suicide. Everyone will need to have a general education on yoga in order to know how to help soldiers do the work out appropriately in order to prevent harm or strain. Specific training to understand military rules and regulations will be provided so training stays in accordance with military training and guidelines. Timeline for implementation will be given to everyone included so everyone can stay on task and meet the verbalized updates, where progress is not being made, and to all be on the same page and understanding. Our timeline of implementation will start with education related to yoga in order to make certain everyone thoroughly understands yoga and why it is important to our project, approximately 3 classes completed back to back. This will be followed by identifying an appropriate location for yoga, purchasing supplies, and setting the location up, completed within the first week of project start. 2 classes will follow the 3 yoga classes where everyone will learn about the military rules and regulations in order to follow their guidelines. End of the first week of project implementation will conclude with identifying appropriate participants in the yoga classes and dry runs of the classes. Week 2 will start with small classes, up to 10 participants in yoga therapy. Classes will be 3 days a week to start. At the end of week 2, a meeting will be set in order to see how the program is running and what changes are needed. Week 3 will begin, again, by 3 classes of the same participants. After week 3, another meeting will be set in order to see how the changes agreed upon in week 2 are commencing. Meetings will continue on a bi-weekly basis with all stakeholders in order to continue monitoring the project and effectiveness. Together we can make this happen. Thank you.